Hello, my name is Christine. I'm going to talk a little bit about my take on a particular reading program that my school district utilizes. My district utilizes a reading program called Read 180. So, this Read 180 is actually a program that considers itself as one of the leading blended learning intervention programs out there. Um, in my school district, it is used as a program in intervention, and some of its more special are co-taught special ed classrooms. This learning intervention program builds reading comprehension, writing skills for struggling students in the area of language arts in grades 4 up until high school. It is a published reading program since 1999, but often is consistently updating itself at an annual rate. It is published through a company, HMH, or Houghton Mifflin Harcourt company, and has been since its birth. So, first of all, before jumping into this program in itself, some key characteristics that I feel that the brain really um, takes huge importance to when it comes to the realm of reading is that first and foremost, the reading skill in itself is so complex. It uses so many multiple areas of the brain, which does entail a lot of um, skills in itself. So the different brain parts that are utilized work with the emotional state, the vocabulary of material, the vocalization, executive functioning, word recognition, being able to identify, the automaticity of reading, and just knowing how to read, how to strategize one's ability to effectively read. Learning to read and reading itself really does require a lot of collaboration of the brain. It has visual component, an auditory component, the listening and comprehension component, memorizing. It also has a lot of parts of recall and inferring, which are skills that are developed with some other realms of such as problem solving and so on and so forth. Some of these areas that the brain really works in are the temporal lobes as well as the occipital lobes as well as the frontal lobe to help with all the different components. The hippocampus and the amygdala also pull in that emotional and memory component. Um, my personal history of this program is that I've never quite taught it. However, I do, being a teacher of the visually impaired, I do have some students who are a part of special education classrooms or co-taught classrooms, and seeing how this has been utilized is interesting. So, with my students, a lot of times the visual component is not always as accessible as I would be desired. So, however, from my understanding and through chatting with teachers who are implementing this program, they feel very confident and feel that it does make a huge difference in their students' ability to read. It really hones into certain areas that help with utilizing different areas of weaknesses and that challenges them to keep improving. The teachers have told me that they have seen huge growths within MAP scores with their students. And essentially, the reading program prides itself with utilizing that brain-based approach of teaching and focusing on the multiple regions of the brain and how they can work collaboratively and cohesively through its program. The program itself is broken into many different parts. However, some of the parts that it likes to gear itself towards is the emotional state and vocabulary, which it talks a lot about how this area of the brain, such as the amygdala, can help with it. Additionally, the vocalization and articulation of reading, which comes a lot from the frontal lobe and Broca's area, as well as the executive functioning. And then going to the occipital and temporal lobe of the brain, we see that Read 180 focuses on that word recognition, vocabulary, and automaticity of reading. Um, like I said, the reading program is utilized in the classroom instruction. However, specifically, it is used when students are monitoring their own progress through their accuracy, their fluency, and their just overall comprehension. Additional supplemental assignments, such as summarizing the passage, is also different assignments that the teacher will incorporate and implement as well. Overall, research does show, both through our textbook by Sosa and through different articles such as the Brown University article, which was found in our course materials, does prove to show that language and the overall idea of reading really go hand in hand with the brain. And taking consideration of how brain-based learning works will help students and teachers be more conscientious of this process.